Good afternoon, everyone. So today I'll be sharing some thoughts on intermittent fasting, a new way to reset and boost your metabolism in diabetes. So the outline for the session will be background and introduction of intermittent fasting, history of fasting, intermittent fasting, variations, types and benefits, how does intermittent fasting work, precautions and contraindications, and take-home message. I'd like to ask a question. Is there a specific diet called diabetic diet? The answer is yes or no. Yes? No? All right. The answer is no. There is no such thing like a diabetic diet. Diabetes patients should have a healthy and balanced, sustainable diet. Next, why is there so much confusion about nutrition and health? One, we have a sea of nutrition information as well as misinformations. Food habits are hardwired in us. People are eating much more than what they should eat. And then this leads us to the diet dilemma. Why do we want to do the extreme diets? That's question number one. Second, has dieting become the new fashion trend? Let's look at the trending diets. We have keto, intermittent, paleo, Atkins, Mediterranean, vegan, Ornish, and there's many more which I have not listed here. We have the potato diet, cabbage soup diet, grapefruit, and the list is we have a long list. We need to get into the history of fasting. Fasting, it has been traced back to the 5th century. Fasting has always been a practice throughout the human evolution. You can see in ancient days, fasting was practiced to help and heal the body. Ancient Greece is believed to be the birthplace of fasting. Hippocrates, the father of modern medicine, is believed to have pioneered fasting. So, this brings us to intermittent fasting. So, what is intermittent fasting? It's basically, the focus is on when to eat and not what to eat. It's the absence of food during a prescribed period. It's a diet regime or an interventional strategy that cycles between brief periods of fasting, either with no food or significantly calorie reduction. Secondly, it does not specify which food you should eat, but rather when you should eat them, and has no complicated charts. And then a recommended definition in humans is a minimum of 14 hours or more. So these are intermittent fasting itself has so much of variations. We have a 1 day a week fast, alternate day fasting, alternate day modified fasting, 5:2 diet, wherein 5 days a week you are on normal diet, 2 days a week you will be on intermittent. Fasting mimicking, which is like once a month diet is happening. Weekly intermittent energy restriction, which is like 1 week you are into intermittent fasting, then the next week will be normal diet, and the most famous is time-restricted eating. So amongst the different types of fasting, the focus is on 16:8 hours of fasting, or it can be 14:10 and also 12:12. Why is everyone interested in this? Because it's simple, less restrictive, and more flexible. Second, you need to eat within a consistent 10-hour window. The most popular is 16:8. Water-only fasting for the remaining 14 or more hours of the day. You need to count the time and not the calories, and it can be practiced early or late in the day. And this is the simple way to start. Steps to begin. You can determine your eating window, the first bite of the meal and first bite and the last bite. You need to fix a time frame and eat within the time frame. Consume a nutrient-rich meal with adequate protein intake during the feeding periods. Consistency and patience is very important. You can go with 2 to 5, you can start with 2 days a week, you can increase slowly to 3 and then to 5, and the goal should be 16:8. But you can decide which one will suit you only after consulting your physician or a clinical dietitian. So what happens exactly during the intermittent fasting? That's the question. We deplete the stored liver glycogen. Basically, the fuel source that's giving you energy is the glycogen or glucose. That a switch is happening and then it goes on to fat utilization. So the metabolic switch after about 10 to 12 hours happens. It is when your body switches the energy source from glucose to fat. You must fast sufficiently for more than 12 hours if this has to happen. You cannot eat so much food that you totally refill your glucose or the glycogen every day, because that's going to be worse. The excess, whatever is consumed, is again stored back as fat. So you can see the picture of metabolic switching, which is the beginning of the fast. The body starts using the glucose or the glycogen for its energy, and then after 12 hours there's a fuel switch, and then fatty acids and ketones happen. It's utilized. So what is the rationale of intermittent fasting, fasting over after 10 to 12 hours? So intermittent fasting, again, as I said, there's a metabolic switch of fuel from glucose to fat, alteration in the cell metabolism including mitochondria, which leads to increased mitochondrial biogenesis, increased autophagy and motor pathway, and then ultimately leads to improved physical performance and stress resistance, improved insulin resistance of glucose, fat metabolism and sugar levels. It also helps in enhanced mental performance. So we need to also have an idea of the circadian rhythm, which should be in alignment with the intermittent fasting works best when it's aligned with circadian rhythm. So what is circadian rhythm? Circadian rhythm it's a 24-hour cycle that are part of body's internal clock. It's running in the background to carry out essential functions and processes. When you look at the picture, you'll get an idea. So you have the peripheral clock and the central clock, and that should be in alignment, starting from sunrise to sunset. So role of intermittent fasting in diabetes and weight loss, which is very important. It helps to control the glucose in the bloodstream, leading to reduced fasting blood sugar levels by limiting meal intake at specified times. In persons with type 2 diabetes, it's proven to lower the fasting blood glucose by almost 5.6%. The current evidences suggest intermittent fasting as an effective non-medical treatment option for type 2 diabetes through improved insulin sensitivity. Obesity is also a major risk factor for type 2 diabetes and development of insulin resistance in obese patients. So 25% of calorie reduction via diet alone or diet combined with exercise improves insulin sensitivity, and there's a reduction in beta cell sensitivity in overweight and glucose tolerant individuals. Intermittent fasting leads to improved appetite control and decreases chronic inflammation, improving several other risk factors of type 2 diabetes. So the benefits, let's look at the benefits of intermittent fasting on health, aging and diseases. It boosts the metabolism, so there's fat and weight loss, which will ultimately lead to improved blood sugar, reduce oxidative damage and inflammation in the body, It also helps in Alzheimer's disease. It reduces the risk of Alzheimer's disease. It protects against neurodegenerative diseases. It reduces the risk of heart disease, blood pressure, and also cholesterol levels. It improves insulin sensitivity and induces autophagy and increases growth hormone. It reduces the risk of developing cancer. Some of the precautions and contraindications of intermittent fasting. If you have a medical condition, you should definitely consult your doctor before trying intermittent fasting, especially if you are a brittle diabetic, if you are having hypoglycemic issues quite often, and especially it is definitely not for type 1 diabetic patients. Patients on sulfonylurea medications should be closely monitored. Patients with low blood pressure, GI disorders, and underweight people are not allowed. People who are on multiple medications like for kidney, liver, heart patients, and people who have migraine issues and eating disorders like bulimia nervosa or anorexia nervosa, pregnant lactating women, children and adolescents or age less than 17 are not allowed. So what do we have to do? We need to follow the common sense diet. One size does not fit everyone. So you need to understand your body first and respect your nutritional needs. Consistency pays more than short bursts of enthusiasm like cravings. Eat as per the schedule plan. Try to cut down on trans fat and refined sugars. Be aware of the hidden sugars, like especially in healthy looking juices and innocent looking drinks. You need to make sure your meals, everyday meals, are rich in fiber, whole grains, healthy proteins, vegetables, and good fats. Do not go to extreme diets. Diet cannot be substituted by exercise. Both exercise and diet should go hand in hand, and both are equally important. But what you need to understand, though you follow intermittent or normal diet, the key is to maintain portion control and have a balanced diet. You need to always invest in understanding nutrition. So the foundation remains the same. Irrespective of intermittent fasting or normal diet, you need to make sure your plate consists of half the plate of vitamins and minerals and fiber, which is like vegetables in healthy cooked forms, and the rest half of the plate should be divided for proteins and complex carbohydrates. I'd like to conclude the session by giving you some take-home messages. One, there is no such thing as a diabetic diet. All you need to do is eat healthy, balanced, and portion-controlled diet. Diabetes patients should always have healthy, balanced, sustainable diet. And intermittent fasting is simple, less restrictive, and more flexible. It extends overnight fast. Extending the overnight fast is easy and effective without any adverse effect. Intermittent fasting causes metabolic switch from glucose to fat-based energy utilization. It improves the appetite control and decreases chronic inflammation. 16:8 or 14:10 is the most recommended, but you can also start with 12 hours. To start with, maybe 1 day a week and then slowly 2 days a week. It's basically the olden days pattern which our elders used to do, like they wake up early, they have their meals and they finish off their dinner early. But now things have changed, our work pattern has changed, so we need to adjust accordingly and try to finish your dinner early or fix a timing according to your duty schedule. So the bottom line is, if you respond well to the structure and have a healthy relationship with food, intermittent fasting not only helps people with diabetes, but also helps in optimizing overall physical and mental health. Thank you so much. I recommend everyone to always make yourself a priority. Good eating habits will only cost you good health. Thank you.